So as you can see, this is a patient's left nasal cavity. Now this is a routine post-operative follow-up endoscopy for nasal washes. As you can see, that's the sphenoid sinus of the patient. I've done a full house FESS surgery on this patient 3 weeks back, and this is the routine follow-up endoscopy for the bilateral sinonasal washes. You can see a little bit of polypoidal tissues are coming back at the roof of the ethmoid area, the posterior ethmoids. Now, this patient is completely conscious oriented, and this is under no anesthesia whatsoever. You can see the inferior turbinate I have reduced with the help of coblation, and that's the opening of the right maxillary sinus right there, and that's the right choana. What you can see right there is a huge piece of net cell. That's the middle turbinate right there. So I've placed a piece of net cell soaked in methyl prednisolone injection solution. So that I have exactly put in the patient's right middle meatus. Now, this patient has a very high eosinophil load per high power field. On biopsy it was diagnosed around, say, it was 150 to 200 eosinophils per high power field. So when patients have a high eosinophil load on the biopsy, they are supposed to undergo vigorous recurrent nasal washes with topical steroid solutions, with budesonide solutions mixed with Ringer's lactate or normal saline. Now, what I'm going to show you in this video, as you can see, this is the methyl prednisolone injection, 1 gram. I'm going to dilute that. I'm going to use distilled water, and I'm going to make it into a solution, and I'm going to take my long thin brown 26.5 number needle, and I'm going to inject all this solution into that piece of medicine I just showed you guys. So the reason of me doing this is because I am currently not using a drug eluting stent, which we normally use of mometasone furoate, as we keep that in the area of the ethmoid and the frontal sinus openings. So as you saw on the left side, the patient had a little bit of recurrence of polyps immediately after 3 weeks of surgery because of the high eosinophil load. The same thing was happening on the right side. So instead of using a drug eluting stent right now, I'm just showing you a convenient, cheap alternative what you guys can do if a patient comes to you for a follow-up like that. So I'm going to give a little bit of wash to clear the nasal cavity and the nasal floor, and I'm going to suction on that piece of medicine to keep it dry. You do not want any Ringer's lactate or normal saline solution to be already present in that piece of medicine, because you want that to be fully soaked up with the steroid solution, which can act as a slow releasing stent. So we normally use uh, a propel stent. It's called as propel, which contains mometasone furoate. But now I'm going to show you, instead of that, we're going to use a piece of net cell and inject it with a methyl prednisolone injection. So as you can see, I have the solution ready, and I'm going to install that in my syringe. So I'm going to use that 5 cc syringe, and I'm going to use a needle as mentioned before. Make sure you do not use a very wide bore or a thick needle, which may injure the patient's mucosal lining inside. As you can see, the patient is completely conscious, so we do not want any injury happening inside. Ask the patient to be really calm as possible, not to make any head movements whatsoever. So once you do that, you take your syringe and you locate that piece of net cell. That's the steroid solution right there. I've taken roughly around 5 ml. You gotta attach that needle. Make sure it is very tight, because if it's loose, it's gonna get dislocated or dislodged inside. So the patient is completely conscious. With careful movements, you go inside and you inject, you pierce that piece of net cell, and you make sure you inject as much as possible till that net cell is completely soaked. So as you can see, it's completely soaked, and keep on injecting till it starts overflowing. So this is how you keep injecting the steroid solution inside the piece of net cell. Now, this piece of net cell is going to hold the solution for a very long time. So I'm planning to keep this inside the patient's nose for roughly about 3 to 4 days. And also, I'm going to ask the patient to be on nasal washes, self nasal washes with budesonide nasal solution mixed in Ringer's lactate, so that there is constant irrigation and there is constant soakage of the net cell with budesonide solution as well later on. So whatever remaining solution is there, you can just pour it over the sinus openings in both the nasal cavities. So the same thing I'll be doing on the left side after weeks observation, but not at the same time. So I'm going to use it only on the right side because it was more on the right side. So this prevents any recurrence of polyps because we have already done a full house FESS surgery. Complete A to Z removal was done, but a little bit of polypoidal recurrence is happening right there. So we can prevent that from happening. You gotta keep uh, you gotta keep telling your patients to come for a routine follow-up once a week after the surgery, 4 times in 1 month, first month post-op, then 2 or 3 times the second month, and 2 times in the third month after surgery. So you got to make sure there is no recurrence of polyps, and whatsoever if there is, you can either use a drug-eluting stent or propel, or you can use this method. Both are really effective.